The World Health Organization states that community mental health services are more accessible and effective, lessen social exclusion, and are likely to have less possibilities for the neglect and violations of human rights that were often encountered in mental hospitals. SATRA implemented a 3-year community mental health program supported by NRTT through Ashadipa Guwahati-based Mental Health Society. Under the program, more than 1,200 patients were identified and around 800 patients were admitted under the project. The admitted patients were getting free medicine, psychoeducation, counseling and caregiver training, but the larger objectives of community mental health program is to destigmatize and demystify mental illness in the community and make people aware of opportunity of treatment for mental illness and its prognosis. Components of the program. Mainstreaming mental health care was one of the objectives of the program, for which mental health review camps were strategically organized in CHMP and FRU, a government hospital. Patients were enrolled in the government hospital as well. Earlier, psychiatrist was hired from outside once in a month. Later, because of the advocacy, Government of Assam appointed one psychiatrist in CHMP and FRU. Community mental health program closed in July 2016. Even then, patients are getting treatment and some medicine in the government hospital. For patients' identification, first approach leading person in the community, aware them about mental health and disseminate project information, then seek cooperation in identification of patients. Bhargava, class 6 student, one day suddenly started biting fellow student and threatened teachers with dire consequence. SATRA volunteer took him to the hospital, also organize a meeting of doctor and the principal of the school. On regular medication and counseling, he was normal in a year. Caregivers are generally close relatives of the patients and they are the one who suffer more than the patients. Caregiver counseling and training is to educate caregiver on mental illness and mental health care, as they are also in high-risk group to develop mental problem. Trainings aims to teach them how to handle social stigma, the patient, and ensure regular dose of medicine. He has been suffering from mental illness from last 15/16 of a year. Since last 4 years he is under the treatment of SATRA and condition improved now. An endline evaluation of the project was done using Cobot Toolbox and data was collected using Android app Kobo Collect. The survey covered 106 randomly selected patients from more than 30 village. Few important findings of the evaluation. Lower educated patients are more in numbers. Primary education, 27.36%, upper primary 20.75%, matric 19.81%, illiterate 16.04%, higher secondary 10.38% and graduate 5.66%. Family source of income, daily wage earner highest at 65.09%, followed by farming at 15.09% and lowest is salaried income at 1.89%. Total yearly family income between 30,000 rupees and 50,000 rupees is highest at 93.4%. 50,000 rupees and 70,000 rupees is at 4.72%. Few questions were asked to patients and caregiver. yes 97.17% and no 2.83%. Useful 73.58% and very useful 25.47%. Sleeping disorder or no sleep 91.51%, unusual social behavior 72.64%, foul language 39.62%, no appetite 20.75%, less sleep 19.81% and others 11.32%.
Exactly, I don't remember what happened in the beginning, but no sleep and afraid to non. Hallucination, I hear some unusual voice and see raw flash and afraid of bus, car, etc. Lack of sleep, whenever I sleep I feel relieved.
Improved 55.66%, recovering 39.62%, not improved 2.83%, recovered 1.89%. The Northeast Social Impact Nessie Award is an initiative taken by Northeast Foundation to celebrate, recognize and promote best practices and innovation in social and community development in Northeast India. Community Mental Health Program presented by SATRA emerged as winner in health category. Yes 99.06% and no 0.94%. Fight against stigma. 100% patients are comfortable telling other people about the illness. Yes 76.42% and no 23.58%. After the completion of the program, many patients who were very poor or unable to purchase required medicine, and in conjunction with the program Trinity Fructa Limited, Mangold RE under its CSR program supported a livelihood program on pilot basis for 20 mentally ill patients and named the project LISA.
We discussed with the patients and caregiver on suitable livelihood activity for the patients and decided to implement a pilot project.
Provided livelihood support by providing young goat training on goat rearing, motivate to adopt scientific method, technical support, vaccine, deworming, feed additive and market linkage. It is important to give a voice to this excluded group to claim their rights and secure their participation in society. It is a livelihood initiatives program with larger objectives to keep the patient busy and enjoy doing the activity. It is expected to be an income-generating activity after an year.
Remember to administer first dose of deworming at here in our place the climate is humid, for which risk of worm is high. Symptoms of worm infestation in goats are tear on eyes and lose motion.
We got 2 goats and medicine for goats from SATRA, and now he is busy whole day with the goats and he knows when to give medicine, mineral mixer, etc.
She was happy and excited to receive the goats, and now she take good care of the goats. I have been taking medicine for mental illness from SATRA and also got 2 goats from them. I thank all the SATRA staff for helping poor people like us.
Thank you very much for watching. Ending here with a song by a die-hard fan of Dr. Bhupen Hazarika, a legendary singer of India.
দুহাতুৰা মনত আছে যৌৱনৰে দুয়োৰে দেহাৰ লাজুকী পৰশ মনত আছে জীয়াই থাকি এখন সমাজ গঢ়িবৰ মোৰ মন আছে জীয়াই থাকি এখন সমাজ গঢ়িবৰ মোৰ পণ আছে য'ত সোণতকৈও মানুহৰ দাম সোণতকৈও মানুহৰ দাম অলপ হ'লেও বেছি আছে অলপ হ'লেও